6 months after Sweden triggered its coronavirus response, Stockholm in the autumn doesn't look too different from Stockholm in the spring. While other countries go in and out of lockdown, the Swedes have stayed open throughout the pandemic. But a large decline in COVID-19 cases came to an end this week, with 533 reported on Thursday, the highest daily number since early July.
The caution that existed in the spring has more and more been replaced by hugs, parties and everyday life. That for many seems to be a return to normal.
From one of the world's highest COVID-19 rates in the summer, Sweden's has dropped below countries that imposed lockdowns like France, the UK and Spain. There have been just a handful of recommendations and restrictions in place. And despite this week's new cases, the government says it isn't planning to get harsher just yet. Schools have stayed open since March, and masks are a rare sight, even during rush hour. This has become very common in most of the world, but in Sweden, virtually no one wears a mask. The health agency doesn't recommend them, saying it can make people more careless about social distancing. Individual responsibility and sustainability are the pillars of the Swedish model, although they shy away from admitting herd immunity as a major target. For most decisions, the government defers to the health agency's chief epidemiologist, TEGNELL.
It's easy to keep the number of cases down when you have sustainable long-term regulation in place, and then when you go in and out of lockdowns. The main problem we had in Sweden was with the high mortality in our long-term care facilities.
It was the devastation of elderly care homes that was behind most of the country's nearly 6,000 deaths to date. Critics now say it wasn't just the lack of a lockdown that was the problem.
The government, together with authorities, was asking us doctors to palliatively plan to give end-stage treatment to otherwise healthy people with risk factors, to give them morphine instead of oxygen, because we don't have oxygen in care homes. Thousands of elderly have died without oxygen that could have been otherwise saved.
The care home watchdog has since reported that mistakes were made, as Sweden recorded more deaths than its 3 Nordic neighbours combined. But now Denmark, a short drive over the bridge from Malmö, has overtaken Sweden's infection rate, with the government in Copenhagen bringing in new restrictions last week.
It's true, we've seen a couple of weeks where the cases in Sweden have been going down while they've been increasing in Denmark. But we also see that Denmark is testing much more than in Sweden. I think they just think that Denmark is doing it okay, and Sweden has just had more deaths.
Sweden may have flattened the curve considerably since the dark days of the spring and summer, but the surge of cases in some parts of the country suggest it's still far too early to know if the Swedish model is working. Rhys, Jazeera, Stockholm.